So for all of you that, are joining us, my name is Melissa. I am with the talent acquisition team at Aspen Dental, specifically specialty. So I work with oral surgeons and endodontists, mainly residents, but also experienced doctors as well. My job, I was just telling Dr. Tin, my job pre-COVID was to travel around the country, visit the residency programs, and take you guys out for nice dinners, do lunches, have steak and wine, and it was a lot of fun. Now, in the midst of the COVID pandemic, we are sitting home. I never leave my house now, so I can't wait to get back out there and see you guys. But for now, we're doing these virtual events. Try to make it as fun as we possibly can. So nothing formal at all. We'll hopefully laugh a little bit. For you guys that are joining us, there is a Q&A button at the bottom of your screen, and that's where you can type in your questions. So any questions that you have, guys, nothing is off limits. Now's your time to really, hear it from the horse's mouth, from Dr. Tin himself. Any questions that you may have. So Dr. Tin, if you want to introduce yourself to everybody.
Hi, everyone. My name is Pathan Tin. I'm an Aspen oral surgeon. I'll give you a little bit of background about me. I'm originally from Los Angeles. I was born and raised in Los Angeles. I went to undergrad at USC undergrad. From USC, I got accepted to dental school at Columbia University, so I moved to New York City. After dental school, I did my training at Montefiore Medical Center in New York as well. And from there, I was working in a private practice downtown and in some of the boroughs before I actually ended up in Aspen. I worked there for about 1.5 years before I got recruited. I knew a couple of my co-residents were working at Aspen and was trying to figure out what I wanted to do and where I wanted to stay. Initially, not too many people know this, but my family comes from, my sister's a dentist. My brother-in-law is an oral surgeon. They have 4 practices in San Diego. She's a general dentist with 2 practices. My brother-in-law is oral surgeon, plastic surgeon, lawyer actually. And he has 1 office that's completely cosmetic surgery, 1 office that's completely oral surgery. And he was actually waiting for me to finish to join the practice to help him out. And I was in a situation where I wasn't sure if I really wanted to move back to California because I just met my future wife. And so I was looking for opportunities for work, and I came across Aspen, and that was 10 years ago. And I took a leap of faith to get out there and try it. And it's been the best decision I've made since for my career. So any questions? Nothing's off limits. You can ask me anything that you feel comfortable asking. It's easier to ask behind a black screen too. So feel free to ask whatever you like. We're here to answer questions to make sure that you understand, what we offer here and what we're able to do for you. And if it's a good fit, we really want to answer any questions that you might have.
So thank you so much for that introduction. A couple of things you touched on there. Number one, did you ever work in Staten Island?
I did not.
Oh, okay. That's where I'm from, everybody.
I'm
I'm sitting in Staten Island right now. And wait, so your brother-in-law is, let me just get this straight. He's a lawyer, an oral surgeon, and a plastic surgeon?
So he went to Harvard Dental School. He went to UCSF for his training for oral surgery. Then he did his law degree in Los Angeles. He did a plastics fellowship in Oklahoma, and he has 1 office that he does complete body plastic surgery, and he has 1 office that he does oral surgery, and he's by himself.
That is insane. He must be like a genius.
Yeah, he's pretty smart.
But he didn't land you, so he's not as smart as we are.
Well, that was one of the reasons. One of the reasons is, he works 6 days a week. He works extremely hard, and he loves his work. But I feel like I'm more of a balanced person, where work is only one piece of my entire puzzle of who I am, and I like other things besides just work. You know, I like to work, but I also like to enjoy myself. I like to travel. I like to play a lot of golf. I like to be with my kids, and having a balance in life was more important to me. And I wasn't sure if I would be able to get that working there. So I decided not to do it.
And you met your future wife. Let's
And
not
my future wife.
let's
Still
not
by
discount that.
myself.
I hear that a lot from residents, you know, when I'm speaking to them and they're in their last year, they're getting ready to like choose a career. We start talking about locations and well, I was going to move back home, but then I met so and so. That
Yeah,
happens all
right.
the time. All right, so we'll dive into the questions here. So what equipment does Aspen provide for you?
Okay. So we are allowed to choose whatever we want. So how we provide that is Aspen has partnership with Henry Schein and some other top tier dental providers that allow us to select anything we like. So I use a BN for my handpiece. I have a backup system, which is another whole system. I use any armamentarium that I want. So there isn't any limitations to what you use as long as it's within reason. You know, I carry a lot of setups. I have everything matching, and when it's bad, I send it out and I get a new one. So there isn't any restrictions on what you like to use. A lot of us used to use strikers, but strikers aren't around anymore. So we use a lot of the BN hand pieces. So I have a BN implant surgical handpiece. I also like to use impact airs, so I use impact airs, and so I have like 10 impact airs. I have a BN system, and I also have a backup system. I forgot the name of it, but I do have. So I have 2 machines and like 10 handpieces. So there's plenty. They're never going to hold you short as long as you're doing your work. They want to make sure they provide the necessary things for you to be able to perform. So.
Yep, awesome. CBCT, do you have use of them in all of your offices?
So Aspen is going through right now a transition where there's a big implant. They're trying to really promote implants. And right now, actually, they're going through the protocols of implementing CBCTs in all the offices. So they are in the process of upgrading all the Panorex machines to the CBCTs. And by the time you guys would be able to join, if you guys are joining next year or in the future, within the next few months, most of the new offices, if not all, I'm not 100% sure logistically, but they are planning for CBCT. So most of my offices now, I have 17 offices. They're in the process right now of getting that done. So I wouldn't say right now all of my offices have it, but I know the software has been loading, and they're in this, they're using CareStream, I think is the system they're using right now. And they're in that process right now.
Yeah, so all of the newer offices, guys, are being built with CBCT in the office. The older offices are being retrofitted for them. So you are correct. They were supposed to all have CBCT by the end of this year, but then COVID happened and the whole world fell apart. So now, sometime next year, every office in the Aspen Dental Network will have a CBCT. Right now, what the specialists are doing is if they have, you know, if they cover a handful of offices and some of them have, some of them don't, if they need a scan done on a patient, they'll just, you know, send the patient to a neighboring office, a nearby office to get the scan. So it's been working out. It would be nicer when you have it in every office, right?
Absolutely.
Is there anything that you have to get on your own as far as equipment, supplies?
No, there really isn't. Everything that I own is owned pretty much by Aspen. They've been very good with everything, even with the PPE situation. I've never had to look for an N95 mask. I got 100 N95 masks sent to my house today. I opened my front door, and I don't even know if I ordered them, but they're on my front door where I got a whole bunch of N95 masks. Everything that I look forward into purchasing every year, I haven't had an issue with. So there's nothing. I think I have a headlight that I bought on my own maybe 5 or 6 years ago just because I wanted it, but there haven't had anything where they've told me I had to buy.
I'm going to ask a question that you're going to answer, and someone is knocking on my door. So this is the beauty of working from home, guys. So let's throw a question out. I think the question was more of if the, like what you have to, not so much what can Aspen provide for you or not provide for you, but what do you pay for?
Okay.
That was the clarification.
I think everything that you need to how do I put this? Capital expenses are things I think that are over $300. So like the hand pieces, the equipment, those are nothing that you pay for. The disposables that you do every day, you pay a percentage of that out of your expenses for like my suction tips, my lidocaine, or the things that my assistants order personally for my patients. I have a separate account that we order all our things from. And from that, I pay a percentage of those fees of those expenses. So that would be some of my medications, or my sedation medications might be on there. I pay a percentage of my implants, my bone, my membrane, my suture. The disposable things are that the one-use time things I tend to pay a percentage of, but the things that get capitally expensed, the CapEx, I do not pay. So those are the things I think that are over $300. I'm not sure what the actual number figure is, but those are the things that I do not pay for. Usually what happens is that item is split into the number of offices that you have in the offices. The owners of those offices pay for those items that you use.
Right. So we call them shared expenses. But you're absolutely right. Capital equipment, things that are more like a one-time purchase that aren't, consumables, disposables, those are the things that Aspen will provide for you guys up front. And then, as Dr. Tin said, they're delivering at 7:15 at night. That's who was knocking on my door. But the dog was going to go crazy, which is why I had to go get it. But I was listening the whole time. So yes, you explained it absolutely correct. I think sometimes people, especially residents, like if you're not familiar with the different models and what exactly a DSO is, a lot of DSOs kind of get grouped together, but there are some differences and nuances between, the different organizations. And so I always like to ask that question about kind of like, what are the expenditures for you as a specialist? Because I think that varies between different organizations. And also, if you're an associate in a private practice, sometimes that can vary as well, the model of how your expenses get taken out. So I think that's important for you guys to kind of understand a little bit of how the specialty model at Aspen works. So you can choose any brands that you want. You kind of touched on that already. What do you travel with?
I have two assistants. So we split up the bulk of the things that we travel with. I travel with my instruments. One of my assistants travel with my instruments because they usually get there before I do to set up my rooms and operatories. I personally travel with my monitor. I have a monitor and a backup monitor. I travel with my implant setup, which would be my implant machine, my spare implant machine, and some of the emergency equipment and the things that I have. But it's usually, we travel with the bulk of our things, or what we do is we get our shipments of our disposables and we put them in all the offices, so we're stocked, so we don't have to carry those things. But usually the basic things are your instruments and your implant machine, your monitor, and those types of things. But everything else is kind of spread out among the offices, so you eliminate traveling with those things. So you just got to be efficient and make sure that you're supplied in each office.
What implant system do we use?
We have a partnership with Nobel Biocare. So 95% of my implants that I place Nobel Biocare. One reason being is the price point that we get them, because we buy them in bulk, and the agreements that we have, it's a less expense to me, and it's a great implant. You're able to choose anything under the Nobel Biocare name. But that being said, if you want to use Straumann implants, you can. I do place Straumann implants as well. Some people place, other brands of implants, but 90, I placed 65 implants, just finished this month, and I think I placed 60 of them were Nobel Biocare and 5 were Straumann. So um, I usually choose that as I know that it's going to work. I set up all the general dentists with the restorative kits, and they're very familiar with it. So if I'm consistent with the implants that I place, it makes their life easier as well. And the cost to me as one of the expenses is lower because of the price point that they're at.
Yeah, I mean, you touched on a few important things there to kind of like keep in mind. Um, Dr. Tin mentioned quite a few times that we're a big network. We have a lot of offices. That gives us a lot of buying power with these brands. We're Henry Schein's biggest customer outside of the US government. So, we're very important to them, and we get things when we need it, and we get it at a very aggressive price point, which helps you, right, as the specialist. It helps the doctor who owns the practice because you're sharing that cost. Um, you mentioned you got N95s delivered to your house. Like, number one, you didn't order them. You were correct. That's something that the specialty team really felt during the COVID situation was just very important to make sure that all of our specialists have their proper PPE because they do travel to different offices. So, we came up, not me, but we, the specialty team, came up with the idea of, hey, let's send it to your house so you always have it with you no matter what office you're traveling to. There were some private practices, guys, during this COVID situation that couldn't get any PPE. Couldn't get gloves, couldn't get masks, couldn't get gowns. So, there are pluses and minuses to every situation, but I think one of the very positive things of working for a big brand is that you do kind of have that brand power behind you. And it makes you very important to these vendors. You mentioned Nobel, huge implant initiative right now. And, the general dentists are getting trained as well. We were sending everyone to Chicago to the corporate office for a nice implant course. But again, COVID, we're not doing that right now. So hopefully by the time you guys all join us, we'll be able to send you. But there's one track for the oral surgeons and another track for the general dentists. So Dr. Tin, you think about those things, which is probably why you've been with Aspen for 10 years, because you think about your general dentists. They're being trained on Nobel implants. So it's a lot easier for them to do the restorations. And that's why, you guys kind of work hand in hand.
Correct.
So can you talk a little bit about the relationship between you and the general dentist that you work with?
Sure. Actually, my job is very similar to a private practitioner. I treat all the offices that I go to as a referral. I develop deep relationships with them. We form trust. We form a conversation between patients where we develop this relationship where you're trying to build a relationship to develop business, right? So we try to make sure that we service the offices and the needs of the office, and that includes answering questions. We have dinners, we have training sessions together. Actually, in my region, we did something where Nobel had come out, and we set up training sessions not only for the dentist, but also the front office, and how to speak to patients and develop an implant initiative. This was probably 5 years ago, and it helped increase my implant revenue. So developing these relationships with these doctors will not only solidify your business in these offices, but it also helps you, when you're not around, to help you see patients that, they might have questions on that are yours, that you might have done a procedure that can help you with. So there's this give and take that you have with these dentists, and developing a relationship helps you succeed in these practices.
And how many, do you get patients outside of the Aspen Dental Network?
I do. So since I've been here like 10 years, I do receive a lot of referrals from some of the general dentists. Some of the general dentists refer to me because the one biggest thing that we have is we accept a lot of insurances. And because of that, I receive a lot of patients from general dentists who have patients in this network that don't have many choices. So I do receive a lot of those referrals. I also receive referrals from patients that need to see me, that have friends that have seen me that aren't Aspen patients, and they go to their dentist and ask, if they can come see me. So I do see patients outside the Aspen system.
What would you say, like percentage-wise, of what comes internally from Aspen?
Internally, I would say 90% of my patients
Yeah.
are from Aspen referrals of the general dentist, and that's what makes it so important to establish these relationships, just like you would in a private practice with your referring. I have 17 offices, so those are my 17 referrals of 90% of my business. So I have to treat them and make sure I develop these relationships to ensure that I have a strong practice within the Aspen group of practices that I go to. So
That's awesome. I like that you said that you kind of treat it as if you weren't working under the same roof as them to
right,
try to build that relationship. I think regardless of the referral, standpoint, I think that that just makes for a much better work environment, right?
right,
Much
absolutely,
better working relationship.
right. You know,
That's awesome.
going
Um,
to these places and making sure that you know we're all equal, and we try to make sure that they don't feel intimidated by you, or you got to make sure that they're comfortable and they come to you, and just developing that relationship helps.
yeah. And, I mean, I have some dental experience before Aspen, and I worked a lot with private practice. And when I would speak to specialists that own practices, no matter what the specialty was, not only oral surgeons, but across the board, if I asked them like what their biggest headache was, everybody said the same thing. It's referrals because, technology has advanced and it's making it a little bit easier for general dentists to do some of these procedures in their own offices and not have to refer them out. So the referral base and that relationship between the specialty world and the general dentistry world, to me, looks like it has really declined over the past few years. That was the number one answer that I would get. So that's one thing that kind of drew me to Aspen when I was kind of doing my research if I wanted to come over to this team. Because I think the way Aspen does it, it creates a really nice relationship where the general dentist who owns the practice, he or she has an incentive to give you these patients because you're going to be the one that's going to do it the right way. You're going to do it faster. So it's going to be more, comfortable for the patient, more efficient for the patient. And you're also doing it under their roof. It's their practice. So they're still making a little bit of money on it too. So they don't really have that incentive to kind of want to hoard all the patients and not send them over to you.
That's part of the selling point is, one of the things is our fees are higher. Everything's about chair time and profitability when it comes to those things. And when you look at those things, if they give you the patient, the fees are higher, we're able to do it faster, which empties their chair to see another patient. So the production and the profitability of the office is higher. So at the end of the day, it's a win-win situation for the owner of the practice because he's going to do better. And the patients are happier, and we're able to do a higher volume for that office. So it makes a big difference.
Yep, absolutely. So let's talk about procedures. What's the bulk of your procedures? Obviously implants we spoke about, but what other things are you doing?
The bulk of my work is dental alveolar surgeries, full mouth extractions, wisdom teeth. I do sinus lifting. We do bone grafting. But I keep it pretty simple in terms of what we offer. The Aspen brand is a denture brand, right? So the bulk of the procedures are done to insert a denture. So we're there to facilitate the insertion of the denture, which really is full mouth extractions. We do a lot of implants now. We're increasing our implant volume quite a bit. I do sinus lifting or things that to facilitate the implants, but I would see most of my procedures are sedation, full mouth extraction, implant, sinus lifts, that some pathology, but your bread and butter oral surgery. I don't get too complex. I like to keep it simple. So I would think that's mostly what we do.
Do you have hospital privileges still?
I do not have hospital privileges anymore. Knock on wood. I would say 60% of the oral surgeons might have it. I'm not 100%, but the bulk don't. I have partnerships of some oral surgeons in the area that can't see. I refer out a lot of the hospital-based. I just don't have the time. I'm extremely busy, and I prefer not to. Just a prefer that's a personal choice. Like I said in the beginning, I'm here to work, but I'm also to be a father, a traveler, a golfer. All these things that I want to do, and I'm not really interested in any hospital-based oral surgery right now.
What's your favorite place that you've ever traveled to?
Oh, geez. Right now, I have 2 kids, so 90% of my trips are at Disney, but we rent a home in Turks and Caicos once a year, and we do a trip to Puerto Rico every year because my wife's Puerto Rican, and those are the trips. But we do a couple trips to Europe too. But anywhere with sand and sun, I'm all for.
I'm with you. I can agree with that. I have 2 kids also, so it's been a while since we've been to sand and sun, except down the Jersey Shore.
Exactly.
So as far, go ahead.
That being said, one of the perks of my job is I take the first week of every month off. So I take about 15 weeks of vacation during my year, which allows me to do these things. But I work 3 weeks of the month. So I take the first week off and all the holidays, plus some other things that we have. And depending on how the days in the month align, I take between a week and a week and a half every month off, which Aspen, the way that the job sets up, allows me to do, which is a huge perk for me. It allows me to decompress, allows me to just reconnect with my family, and it's a nice thing to be able to have. So we set up our own schedules. So being able to set up our own schedules allows us to do some of these things. I have 17 offices, but the way that it's set up and the way, since I make my own schedule, I only work between 14 and 17 days a month. And it's a great combination of work and play.
So I remember you telling that story at the Vibe event in February. It's so funny because I forgot that was you that said that. I remember you telling that story, and I promise you, every single specialist that I speak to, I tell that story. It's too funny.
Yeah.
Because they don't believe me when I say, yeah, you have full autonomy over your schedule. They're like, okay, you say that now, but they're going to say, oh, you have to come in this day, that day. I say, no, really. We have an oral surgeon that takes a week off every single month. And he's still full time.
I'm full time. And how many oral surgeons are there in the company right now? Do you know?
I don't know. There's 130 or so specialists in total, and there's more oral surgeons than there are endos. So I don't know the exact number, but
I take a week off, and my production for the year, I'm in 3rd place. So,
I mean, that's amazing.
Mm-hmm.
Guys, you have to be 15 days per month working in order to be considered full-time. Anything less than that is considered part-time for benefits purposes. But yeah, you can make your own schedule. I did one of these with an endo, and she, similar to you, she likes her time off. They like to go hiking. They like to travel. They go camping. They do all these things, her and her husband. Dr. Emily Case, do you know Dr. Case?
No, I don't.
She's an endo. But she doesn't want to work a lot of days in a row. So she works 3 days a week, but she's still full-time because she does 3 10-hour days.
Yep.
So that's her schedule. She likes to have more days a week off. So you really do have full autonomy over your schedule. I am not lying when I say that. These are real stories, and I'm going to continue to use your story, Dr. Tin, because it's a good one. So on that subject, let's talk about benefits. What do you get as far as full-time benefits? And then I can speak to the part-time benefits because I don't know if you're too familiar.
I get 401k benefits where there's a match up to, I think it's a 100% match for the first 3%, something like that. It ends up being where if you max out your benefit, I think they contribute maybe $10,000 to $11,000 per year towards your 401k. I get full regular benefits, I think I get vision, health, my family benefit. Also, I know that I used to get, I have a 2-year-old who's in a Montessori school that's considered daycare. So there's a daycare that like, it's like a HSA type thing for daycare as well. So it's a normal package that you would get that includes medical and 401k. So I'm not sure if there's any specifics that someone's asking, but it's a,
Yeah. Do you use the company car?
I do not. I had it's a great car. It's a Nissan Pathfinder.
Yep.
I got it and I loved it. Unlimited driving on it. You get to drive it. They give you a gas card. They make it really simple for you to drive, and they pay for your insurance. They pay for your maintenance on the car. All you do is drive it and return it after I think 90,000 miles, and you get a new one. And I think they changed the model now, the new Pathfinder. So it looks like a really nice car. It hurt my back a little bit on the seat, so I have my own car that I drive. Mm-hmm.
Yeah. So in addition to the regular benefits, like Dr. Tin mentioned, guys, if you're full-time 15 days per month or more, you do get the option to get a company car. If you don't want to take the company car, you can drive your own vehicle and you'll get a mileage reimbursement for your miles. So it's really your choice. If you're part-time, you do not have the option for the car. You get your mileage reimbursement. Part-timers are not eligible for vision, 401k, the life insurance opt-in. But one nice thing that Aspen does for their part-time specialists, which a lot of other places don't do, is they do give the part-time specialists health benefits. It's really nice for part-time because that's not really the norm. You have to work at least 4 days a month to qualify for the health benefits. How's your dental plan, Doc?
It's good.
I'm sure you know a dentist or two that can help you out,
Yeah,
right?
exactly.
Okay, so are you doing your own consults? Well, let's combine these few questions because this is kind of all in the same category. Are you doing your own consults, treatment planning, and also who is following up with your patients post-op if there are any issues?
Okay, so how it usually works is the general dentist always come up with the treatment plan because the treatment plan is decided by the general dentist. So they come up with the treatment plan options. You can see the patient either, so they book your patient into your schedule depending on, we usually go once a month or twice a month depending on how busy the office is. And usually you see the patient or that day to do a consult. And if you want to do the procedure that day, you can. A lot of offices also send, we have this called Citrix. It's a mobile program that allows you to review your patient's medical histories as well as their x-rays prior to your arrival. So if you have any questions regarding the patient, you can make a phone call to the general dentist and kind of make sure you're all on the same page prior to. I also give my cell phone number out to all all the general dentists have my number, so they know I'm going to call them back and we're going to discuss any questions that we might have. I've also been in this region quite a bit of time, so they know what my expectations are in terms of what I want prior to the appointment, as well as if they have any questions, they can reach out to me regarding, anticoagulation or any medical history questions or the things that I might require before the patient arrives, so they don't take a slot in my schedule if we're not going to do the procedure. So you have complete autonomy in terms of how you want to handle that. And once you get into the groove of things as you're working here, you can make those decisions and make sure those doctors are aware of that so that you can have a smooth transition to the patient and being able to treat these patients and know what you're seeing beforehand.
And kind of ties back to what you were saying before about having that relationship with the doctors, because, of course, guys, there's going to be some growing pains in the beginning, but that's going to be in any practice that you wind up in. If you take 10 dentists and put them in a room and show them the same exact x-ray, you're going to get 11 different treatment plans. That's just the way it is. So what I also liked about the Aspen model was, Dr. Tin, you as the specialist, if you get a patient in your chair and the treatment plan is a little bit, different than what you would, maybe how you would want to proceed, you don't have to call the doctor. You don't have to text him or email him. You can just walk out in the hallway and say, hey, doc, come here. You guys can kind of hash it out together, figure out what's the best course of action for the patient. while
And
the patient is still in the chair.
we do that quite a bit. And, you know, that's part of it, is making sure that everyone's 100% committed to the treatment plan that's being offered, and what we're executing, we all agree on, including the patient, and that's done in real time most of the time. So it's a great feeling to be able to have that, and knowing that when you're treating that patient, everyone's on board, and if you have any questions, you're able to answer them. Also, the follow-up questions is also with the relationship issue. You know, there are going to be times when, you know, a patient that comes into the office that you treated maybe a week ago is still in pain, or it has a complication associated with the procedure that you've done. And being able to have that relationship with that doctor, say, where he goes, hey, this patient's here, so-and-so, they're feeling this, this, and that. And you're able to solve most of your issues just by being able to talk to this doctor and feeling comfortable with them on how they're going to help, you know, the patient who's having a complication for a surgery that you did and you're not around for. There has been a couple times where, you know, when the patient calls me, and just by hearing what the situation is, you know, I make a decision whether or not, hey, maybe I want to go see that patient, and I will. You know, I'll call my assistant. We've opened an office before and had the patient come in and see them and make sure everything's okay. And 90% of the time it's nothing, but it gives you the sense of, you know, reassurance that everything's okay. And everyone's there to help you and make sure that if you have that situation, that we can take care of it and make sure everyone's okay.
Awesome. Kind of like switching gears a little bit, but sometimes the questions come in a little random. What is the farthest that you travel to an office?
Okay, so I have 17 offices.
I would say that's probably one of the bigger territories in the company, if not maybe the biggest.
I'm very lucky in a lot of ways, and I come home every night, so I don't have to stay in a hotel, because most of my offices are within an hour and 15 minutes. Okay, but I do have 3 offices that are 2 hours and 15 minutes away. So I travel, I think, about 3,000 miles. I calculated on my car, 3,000 miles a month is probably an average amount that I drive. So 2 hours and 15 minutes, I do maybe once a week, because I only work 3 weeks, so those are the 3 days. And everything else is within an hour and 15 minutes from my house.
That's actually really good.
Yeah.
It's a good territory.
Yeah.
Especially with that many offices, I was assuming that some would be farther away, but you know, where you are is kind of like where the Aspen was born
Yeah.
in the well,
Mm-hmm.
Syracuse area really, but like that whole upstate New York area. So, do you cover more than one office in a day?
Sometimes I do. So how I do it is everything's based on the amount of patients, the need in the offices. Every office has a different need, and we're there to make sure that we're able to fulfill the needs of every office and the needs that they have. So some offices are slower. So like, I'm very lucky that a lot of these offices are close to me. So what I do is I split some of the offices in half. So I might go 8 to 12 at one office, and then I might go 2 to 6 in another office, where I finish at 12. My assistants pack everything up. We drive maybe 30 minutes, no more than 40 minutes. And I always do it where I go to the farther office first, and then we drive closer to home on the way to the second office. And I'm able to do that because my offices are kind of in the same vicinity. So Buffalo has about 7 offices. Rochester has about 7 offices, and we're able to do that. And it benefits me because I'm able to keep those days off that I like, and I'm able to service these offices, and they don't usually need more than the time that I give.
Yeah, I mean, that's not typical. You're the first doctor that I've asked that has said yes to that. So you definitely are lucky that you have all those offices around you. Well, for a lot of the doctors, you know, the offices aren't that close together. They're a little more spread out. And so for them to kind of do half a day wouldn't really work out. So, and then you mentioned your assistants kind of packing up and going with you. So a question that I get a lot is, you know, do you have different assistants in every office? Can you talk about like how you get your assistants and if they stay with you?
So my assistants actually have been with me 6 years or so. So I've had the same assistants for quite some time. I have a male and a female assistant. They both travel with me. The male assistant travels with me 100% of the time. The female assistant, she does not travel to the 2 hours and 15-minute offices. I pick up another assistant at those offices that's an amazing assistant, that she fulfills the role of my other assistant. So they travel with me. The male assistant travels with me 100% of the time. The female assistant's with me 80% of the time. And there's 3 offices that I go farther away to that she doesn't come with me to. But I have the same assistant in those 3 offices that travels in that one territory that's owned by a different owner. So I have 3 assistants only.
So, for anyone that's like a little unfamiliar with the Aspen model, Dr. Tin mentioned before that he kind of treats the practices like as if he owned the practice and he was, just working with the general dentist. The assistants are yours, guys. So like you can be as involved or as uninvolved as you want in hiring these people. I have an oral surgeon that's coming on board that we just hired that has an assistant that he wants to bring with him. And, he texted me and said, hey, can I bring an assistant from the outside? I said, yeah, of course. You're the one that has to work with these people every day. So of course we're going to have certain, guidelines, obviously, for legal purposes and everything else, but really it's up to you. They work for you. You guys are a team. And you need to be able to work as a team. And then we have some oral surgeons and endos that have been with us for so long that if their assistant leaves, they don't have time to interview. They don't want anything to do with it. They say to us, just find me somebody. You know what I want, just find someone. But if you want, you can bring your own, you can hire your own. It's really up to you. So you can really build your team that you're going to be working with every day, which I find to be really nice. Especially in a specialty, I think that's very important to have good qualified assistants and have like a good team working environment. Let's see, we answered this question already. How far in advance are you building out your schedule?
The way that I do it is I only make my schedule out. I just did my November schedule yesterday. I try to keep my schedule out 1 or 2 months only. The reason being is I don't want necessarily people coming in and scheduling November. I'm looking to schedule them in October, right? So I usually make my schedule 2 months in advance, and that's as far out as I usually go. And things change, and sometimes I do change my schedule a little bit, but usually I try to solidify everything for 2 months at a time.
You mean like when you want to squeeze a golf day in here or there?
Exactly. Right. Exactly.
or you plan a Disney trip?
Exactly.
Yeah. Can an oral surgeon be a practice owner?
Okay, so one of the things that, you can actually, but the model is set up for the practice owners being general dentists, and the reason being is when you bring new doctors on board, there's got to be a mentorship process. There also is, if a dentist is out of one of these offices, usually the owner who travels around and tries to manage his territory would fill in and things like that. We're unable to do some of those things. So I would think that there was a couple doctors, some surgeons that had partnership percentages in one office or 2. I had been offered that a couple times, but it's not where you're an owner of a region like the general dentist. They do offer shareholder to become a shareholder, where a lot of the specialists bought shares in the ADMI stock, which has been pretty profitable. So if there was a con in terms of our job, there isn't really a setup for an ownership, but it also can be a pro, because when I look at it, if I was an owner and there's a lot of extra work and a lot of extra things that are going to take me away from doing the things that I like to do. And one of the reasons I chose this job is having some extra time and freedom, and having financial stability, and having some other things that I really like. And so I wouldn't choose to be an owner per se, but I don't think at this point there really is an option for that.
Correct. So you kind of touched on something that I wanted to dive into next. I always get, someone always asks the question, how much money do you make? You don't have to answer that.
Oh, is it? Did
But
someone ask me that?
actually, let me say, someone always asks that question. Not in this group. We don't have that.
There hasn't been any financial questions. I'm actually surprised.
Well, that's what I kind of want to get into now because, you know, you would think like in this format, they would be comfortable to ask it, right? Because we're not face to face. That's why I typically get that question. And I always tell the specialist, you don't have to answer that. Just give us a roundabout ballpark. And Dr. Elliott actually was like, no, that's okay. I'll tell you what I make. And he just,
Oh, right.
it was funny. But I guess if you could talk a little bit about just in general, the question that did come in was, what can you expect to maybe make like as a first year oral surgeon if you're full-time? And does that compare to, let's say, working at a private practice?
Right.
And then if you could talk about kind of like what the earning potential is over the years, because it changes from years.
So everyone who starts your career, when you're in dental school or when you're a resident, you always say, at this day, I wish I'd be able to make this much money so I can pay my loans off and I could do this and you're always looking to see what the trajectory of your career is going to be. I think that's always important. You know, everyone's worked very hard at trying to be able to get to a certain level in life. And, you know, they're at that point, we're almost there where you're going to kind of get the rewards of all that work you paid off. Joining Aspen, when I first started, it changed the entire trajectory of what my financial compensation was. It made me realize goals that I set for myself much earlier, and it made me reach peaks that I never thought I could see. And these are the things that I never thought I would ever reach at such an early age. And the way that the Aspen model is set up, it really helps you reach these goals. You're able to see a great deal of amount of patients. You're compensated very well, and the referral base is there for you. So how much I make?
No, you don't have to answer that.
But
I was
most of
just
these
kidding.
people know what the breakdowns are. We'll just say last month, I finished the month, which was yesterday. I did $502,000 worth of production. So based on that, you guys can kind of get an idea.
Sure. We, some of these people on the call, I haven't had a chance to speak to personally, so we haven't gone over compensation model, but just so you know, guys, not to kind of like air your laundry, Dr. Tin, but the oral surgeons get paid 40% of production. So you can do the math on that and kind of see. And obviously there are some things that come out of that, like we spoke before about implants and supplies, but.
So at the last vibe session, we'll use those numbers as a general idea of what you're after, what is basically the average oral surgeon for Aspen. The first year, you're expected to make right around $750,000. 3 years into it, it's about 1.1, 1.2 million. And maybe after 5 years or so, the average I think is 1.5 million. So
Yep.
Those are the numbers that you can gauge yourself on. It's based on territory. It's based on you, what you're after. You know, there's a lot of things that help you get to those numbers. You know, your work ethic, your ability to build these relationships with doctors, your ability to be open to, you know, saying yes to things, saying yes, you know, then there's a lot of factors that come into your success, if here or anywhere else, right? So the only thing I can say is if you have these criteria and have these characteristics that allow you to succeed, you will succeed at Aspen, and you will succeed at a higher rate than you would at any other place. That's based on what you bring to the table as well.
Yep.
They will give you all the tools necessary to be able to be successful. It's how you take those tools that they give you and how you handle them and how you move with them. So.
I just realized that my dog has like been running around in the background, so sorry about that, guys. But you know, everything that you said is just, it's spot on. And, you know, there's a learning curve, right? So that's where that jump comes from, like year 1 to years 2, 3, 4, 5, and moving forward. Because, you know, I think first year you're just starting out, you know, and you're not going to be as efficient, you're not going to be as fast, so you're not going to see as many patients, and that's okay. We know that. We want you to be comfortable. There's never any pressure from anybody above you to produce or anything like that. So you will go at your own pace, but you will make money. That's just the bottom line. Our oral surgeons make more money than, you know, the national average year over year, like by leaps and bounds. So I always tell people it's life-changing money, and it really is. You can set yourself up for a nice life. I have 3 last questions, and these are my questions that I ask every doctor at the end.
Okay.
So the first one is, what do you like the least about working for Aspen?
I think one of the things, it deals with the ownership aspect in some ways, where you have to remember when you work, it is not a private practice and it is not your practice, right? So there are some things where you're not making decisions on, and you have to be okay with them. And these are some of the things that a lot of us have type A personalities. And I think that, how do I put it? You have to be okay with other people making decisions, but that's part of the good as well, right? But I would think, you know, since you're not the owner, you don't have final say in things. And, but usually it's okay, if that makes any sense.
No, it does. It does. The number one answer I usually get is the travel. So that was a little something
I'm not,
different to throw in there. So what do you like the best?
I like being able to, when I'm working, I work hard, but I'm also able to have time for my family and for myself. I feel like I'm a balanced person. I'm not like my brother-in-law who works 6 days a week, that barely sees his family, that's unable to do anything but work. And that's never me. You know, I think I'm more than that. I mean, you know, and having the opportunity to be financially successful and having time to enjoy it and enjoy it with my family or doing the things that you love is a huge benefit. And that would be what I would say.
Absolutely. And the last question, what advice would you give to residents, you know, oral surgeons that are just starting out?
You know, yeah, I think that choose a career or choose a job that suits you best, that you enjoy, that you're financially successful in, that you're able to not just do oral surgery like myself. I really think that being balanced and not being one-dimensional is really important. It's helpful in life, and I think that for your overall health, it's going to be a better choice 20 years from now. So
I agree, guys. Listen to us old folks. We were your age once, where we just wanted to go, make money, work. But now I'm with you, Dr. Tin. I like my downtime. I like to be with my family. And I mean, you could talk to Murph for me and tell him to stop working us so hard. Maybe we'll get some downtime.
Exactly.
So that's everything that I have. I want to thank everyone who participated and who jumped on and listened. I hope it was helpful. I hope you learned some things. I know I got a lot out of it. So Dr. Tin, thank you so much. I know that you have long days. I really appreciate you taking the time to do this for us.
Yeah, thank you very much. If you guys have any questions or have anything where you want to reach out and ask me anything or have questions about anything, feel free to reach out to Melissa, and you can get in contact with me and we can answer those questions for you. And hopefully we'll see you guys soon.
Yeah, thanks so much. Everybody have a good night.
Take care.
Bye.